Spinal fracture is also known as a vertebral compression fracture. A vertebral compression fracture occurs when one of the bones in your spine, called vertebrae, weakens and collapses. This can cause severe back pain and may lead to other conditions that affect your overall health and quality of life. Many fractures occur as a result of osteoporosis. Treatments for back pain include bed rest, special exercises, back bracing, and pain medication. But if your back pain is from a compression fracture, these treatments may not work. Non-surgical management has been shown in clinical studies to have limited effectiveness in reducing pain and improving function in long term compared to interventional treatment. Thus, treatment options like balloon kyphoplasty should be considered. Early diagnosis and treatment are important steps to avoid the downward spiral of complications associated with vertebral compression fractures. Over time, this condition may lead to pressure on your internal organs and cause reduced activity and mobility, sleep disorders and reduced appetite, reduced lung function and trouble breathing, feelings of isolation and sadness, greater risk of future fracture, and risk of death. People with spinal fractures are at an increased risk of complications and death compared with people who don't have spinal fractures. When left untreated, spinal fractures can cause your spine to shorten and curve forward. This stooped or hunchback is called kyphosis, which makes it difficult to walk, reach for things, or do other daily activities. Balloon kyphoplasty is a minimally invasive treatment that can repair spinal fractures caused by osteoporosis, cancer, and non-cancerous tumors. The procedure is called minimally invasive because only small incisions are necessary and typically takes about 1 hour. General anesthesia is usually not necessary. IV medication is given to relax you and numbing medication is injected into the skin. 1 or 2 small punctures are made into the skin in your back. A small pathway is made into the fractured bone and an orthopedic balloon is inserted. The balloon is carefully inflated to raise the collapsed vertebrae. The balloon is then deflated and removed, creating a cavity or space within the vertebral body. The cavity is filled with special cement to support the surrounding bone and prevent further collapse. You can think of it as an internal cast. Although the complication rate for balloon kyphoplasty is low, as with most procedures, serious adverse events, some of which can be fatal, can occur. These include heart attack, cardiac arrest, stroke, and embolism. An embolism occurs when blood, fat, or cement migrates to the lungs or heart. Other risks include infection, leakage of bone cement into the muscle and tissue surrounding the spinal cord, which in rare cases can cause paralysis. Leakage of bone cement into the blood vessels, resulting in damage to the blood vessels, lungs, and/or heart can also occur. After the procedure, a nurse will monitor your condition in the recovery room. You'll be encouraged to walk, move about, and assess how your back feels. Your doctor or nurse will explain limitations, if any, on your physical activity and answer questions you may have. The nurse will give you care instructions for the small puncture site on your back. You'll be scheduled for a follow-up visit in 10 days. What causes spinal fractures? Most are caused by osteoporosis, a disease that causes bones to become weak and break easily. Certain types of cancers or tumors can also cause spinal fractures. How common are spinal fractures? Worldwide, 1 in 3 women and 1 in 8 men over the age of 50 are affected by osteoporosis, a common cause of vertebral compression fractures. Many compression fractures go undiagnosed and untreated, often because people consider back pain a normal part of aging and don't mention it to their doctors. But if you leave it untreated, you could be at risk for more injury and even death. What are typical symptoms of a spinal fracture? A spinal fracture may cause mild to severe back pain and can occur after simple daily activities such as sneezing or lifting a light object. How are spinal fractures diagnosed? Your doctor may press on your back to locate the source of your pain. You'll have images like X-ray or MRI scan taken of your spine to confirm the diagnosis. What are the benefits of balloon kyphoplasty? Compared to non-surgical treatments like a back brace or oral medication, people with spine fractures treated with balloon kyphoplasty experience several benefits, including less back pain, more quality of life, better mobility, less time on bed rest and fewer days where pain interferes with daily activities, and satisfaction with the procedure. Is balloon kyphoplasty covered by insurance? In most cases, the procedure is covered by Medicare and private insurance carriers. If you have any questions regarding your policy or your coverage, contact your insurance carrier. Who performs balloon kyphoplasty? Specialists trained to perform the balloon kyphoplasty procedure include interventional radiologists, some orthopedic surgeons, and neurosurgeons.